Acute Care Nurse Assistant, Module 2, Content Outline, Theory Objectives. Section 1. Basic Terminology. Section 2. Major points to note during change of shift report. Patient identifiers, name, ID band, note room or bed number or diagnosis. Focus should be on name. Report variations, Cardex, computer, verbal. Guidelines for listening to patient report. Note patient's name, room, bed number, diagnosis, and any care you are to give. Include any important time requirements. Ask questions if you do not understand. Assignment. Section 3. The care and important changes in patient's condition to report to a licensed nurse. Report to the licensed nurse and other members of the health team the care you have given and your observations about the patient. Reports must be prompt, thorough, and accurate. Report only those things you've observed or did yourself. Report as often as the patient's condition requires, or as often as requested by the licensed nurse. Immediately report any changes in the patient's condition. Recognize and report possible reactions to drug therapy, such as rashes, nausea and vomiting, dizziness, shortness of breath, blurred vision, diarrhea, odor, bruises, lumps, and bumps. Other abnormal signs and symptoms to report include changes in vital signs, pain after vital signs, intake and output, level of consciousness, behavior, breathing, activity tolerance, appetite, change in drainage, change in mood, and safety level. Section 4. What should be done when faced with an unfamiliar task? Perform tasks only within the defined parameters of roles and responsibilities of the nurse assistant. Do not perform tasks for which you have not been adequately trained. Recognize the limits of your role and knowledge. If a team member asks you to perform a task you do not know how to do, or is beyond what a nurse assistant is supposed to do, explain the limitations of experience, training, and role of the nurse assistant to the team member, and refuse the assignment. Section 5. How to communicate effectively with others according to healthcare team structure and lines of authority. Review principles of communication. Describe the common reasons for communication breakdown and methods for correction. Use effective communication skills with patients and team members. Be aware of nonverbal forms of communication. Evaluate the ability of others to understand, asking for feedback. Use assertive communication, such as I messages, giving and receiving feedback and clarifying instructions. Respect the healthcare team's structure and lines of authority. Section 6. Guidelines for nurse assistant documentation and data retrieved. The patient's record is a legal document. The nurse assistant's documentation should follow the following guidelines. Write legibly with black ink and always use a readable signature. Sign using first initial, last name, and title. Draw a line through mistakes, write error above, and initial. Don't white out, write out, or erase mistakes. Draw lines through unused spaces so they cannot be filled in later. The patient's record is the central document of treatment. Reports must be factual and exact. Use the terminology and abbreviations approved by your facility. The nurse assistant must recognize the difference between what is observed, objective, and what the patient says, subjective. Use quotes for patient's comments. Record actual time of patient care and events. Be brief and to the point. Record patient information on the flow sheets, graphic, or records as required by the hospital. Retrieve information from Cardex or computer for report. Be aware of Do Not Use abbreviation list available in most hospitals. Section 7. The nurse assistant's responsibility in documentation, admissions, discharge, and transfer information. Admission. A record of the patient's condition is taken upon admission. The nurse assistant collects and records the admission data regarding personal effects, vital signs, height and weight, and other information as directed by the licensed nurse. Belongings list. Transfer. Document nurse assistant's activity in transfer or discharge procedures according to hospital protocol. Belongings list. Discharge. Assist with discharge planning, i.e., keep the licensed nurse informed of the patient's ability to perform ADLs. Document the method of transport for transfer or discharge. Belongings list. Section 8. The importance of informing the licensed nurse when the patient has special requests regarding care or treatment. Patients have the right to refuse treatment. When a patient refuses a request stopping a treatment, respect the patient's wishes and notify the licensed nurse and document appropriately. Review Advanced Directives, Unit 1. Section 9. How to establish a helping relationship with patients of all ages, diverse cultural backgrounds, and special needs. Establish a helping relationship with patients from various cultures and age groups, from adolescents through geriatric. Show respect for cultural and religious differences of patients as well as team members. Avoid use of slang when talking to patients and families, as slang terms can be easily misinterpreted by someone who speaks little English. Give explanations in more than one way. For example, I'll help you with your mouth care. I'll help you brush your teeth. I need to take your vital signs. I need to take your blood pressure and pulse. Communication for special needs. Patients who have had strokes, CVAs, may not be able to understand the spoken word or may have difficulty expressing themselves clearly, with aphasia. Others may have special communications needs because they are hard of hearing or speak little English. Communication aids such as the following can be helpful: picture boards, communication boards, interpreters, amplifiers, and computers. Various ways for patients to call for help: call light, geriatric call light, bell, soft touch call light. Section 10. The proper procedure for reporting and documenting accidents, unusual incidents, injuries, falls, and errors. Accidents, incidents, and errors are reported immediately to the licensed nurse or supervisor, including those involving patients, visitors, and staff. Errors in care include giving a patient the wrong treatment or forgetting to give a treatment, broken items owned by the patient, such as a denture or eyeglasses, loss of patient's money, clothing, or other belongings, such as hearing aids, falls or injuries, patient abuse, assaultive behavior. Record error on facility-specific form. Section 11. How to take a telephone message. Elements of a good message: date, time, caller, name of person taking message, number to return the call, content of message. Deliver message promptly to the appropriate person. Reinforce writing skills as needed. And never take an MD order or report of lab results. Refer to a licensed nurse. Section 12. The use of computers in healthcare and the role of the nurse assistant. Computers. Information systems that collect, send, record, and store information. The information is retrieved when needed. Medical records and care plans are on computers in many facilities. Computers are easier, faster, and more efficient than writing. They are also more accurate, legible, and reliable. Departments such as X-ray, laboratory, dietary, and pharmacy can communicate with nursing units by computer. This type of communication reduces clerical work and telephone calls. Computers may be used to monitor blood pressure, temperatures, heart rate, and heart function. Computers store vast amounts of information that is easy to access. Only certain individuals are allowed to use computers. These individuals have access codes or passwords that allow them to access the computer files. Computer access or input according to hospital policy for nurse assistant's role, such as for supply requisitions, patient location, dietary requests, record vital signs, and patient data. Computer confidentiality. Follow HIPAA regulations. Section 13. The role of the nurse assistant in reinforcing health teaching. Health teaching is helping people learn what they need to know to maintain or regain their health. Patients have a right to health education. Adequate teaching to ensure that patients understand what they must observe and report to their healthcare provider, as well as what they must do for self-care, is part of meeting standards of care. The State of California Nurse Practice Act mandates that health teaching is a registered nurse responsibility. The responsibility of the nurse assistant is to reinforce teaching as directed by the registered nurse, by coaching and encouraging, setting up the equipment, referring questions asked by the patient to the licensed nurse. If the nursing assistant is not familiar with a procedure in the teaching plan, she or he should ask for help from the licensed nurse. Allow opportunities for return demonstrations, practice, and reinforcement during hospitalization. Section 14. Identify basic steps of learning. Learning is the acquisition of new skills, knowledge, or attitudes. Individuals with health problems may need to make changes to their lifestyles, understand and administer therapies, or manage signs and symptoms of disease. The following are principles of learning. Reinforcement, rewarding the learner for making the desired response. Example, praise. Practice, the opportunity for practice and frequent repetition of a new skill increases the rate of learning. Feedback, information given to the learner that compares his or her performance during practice to the desired performance, helps people to learn. Active participation, personal involvement in a task, making learning easier. Provide several learning styles: sight, touch, movement, hand and object or piece of equipment. Hearing or observation. Audio-visual aids. Provide picture or illustration of the learning material. Sequence of material. Information should be given from simple to complex, known to unknown, well to ill, normal to abnormal. Factors affecting readiness to learn include physical status. Learning is decreased by fatigue, hunger, lack of oxygen, lack of sleep, anxiety, drugs, etc. Patient may have many problems that may change or slow their ability to learn. Examples: shortness of breath, pain, poor vision, or poor hearing. Maslow's hierarchy of needs. Immediate needs, such as hunger or pain control, must be met before secondary needs, such as learning. Vocabulary level. The difficulty of words used affects the person's ability to learn. Motivation. The desire to learn positively affects learning readiness. Learning styles. Different ways in which people learn best. Hearing, seeing, reading, return demonstration, and practice. Learning is most effective when a variety of learning styles is used. Culture and values. If the material is different from the patient's culture or religious beliefs, learning will be more difficult. Support systems. Family or significant others should be included in the teaching. Behavior modification. A method of teaching that rewards desired behavior and it ignores undesired behavior.